Hello, everybody. Good morning, good afternoon, wherever you might be. My name is Josh with Viventium, and thank you for joining us for today's webinar, COVID-19 Regulatory Updates and Frequently Asked Questions. We appreciate you spending a part of your day with us here. We have a full hour of information ahead of us, so we're going to get started very quickly here. Before we get to our presenter, I do want to go over just a couple of housekeeping items. If we can move to that slide. Great. So Webinar 101, just a couple items here. We will be sending the recording and the slides. Give us about 24 hours for those to get to your inbox, but those will be heading in your direction. Please use the Q&A box for questions. So we have a large audience with us today, but I know our presenter does like to monitor the Q&As, the questions coming in, and try to pick off as many of those as possible and make this as interactive as possible. There's really two ways that you can interact with us as panelists, and that's through the Q&A box and through the chat. And I just want to make it clear that for your questions related to today's content, please use the Q&A box for maximum visibility there. We are going to pause here in just about 10 minutes to do a couple of polls, and we hope the information we're going to gather there is useful for you. We're going to share the feedback there, so we appreciate your participation in those polls. So with that, I'm going to turn it over to today's presenter. We have Kara Govra with us. She is an attorney and a compliance expert, has been staying on top of all things COVID for the past goodness, what's it been now? 2 months, 6 weeks, 2 months, something like that, but has done numerous presentations on all things COVID-19, and we're excited to have her today. So Kara, take it away.
All right, thank you. Hi, everyone. It is good to be here with you. We are going to talk about an assortment of things today. First up, we'll talk about keeping the workplace safe. This includes a lot of the sort of FAQs we've been getting over the last 6 weeks. So we have answered tens of thousands of questions through the on-demand service, and this is sort of the set that is most often asked by employers, so we'll cover that stuff. Then we're going to spend the bulk of our time on the FFCRA, so the Families First Coronavirus Response Act, and that's the law that is requiring employers to provide paid sick leave and expanded FMLA. So we'll spend about 30 minutes on that and getting you up to date on the DOL's current set of regulations and answers to questions. And then we'll talk a little bit about reducing hours and closing towards the end. All right, so let's get into keeping the workplace safe. This first slide is just some basic CDC guidance. We're all pretty darn familiar with this, but there are a couple things on here that you might not have encountered yet. The first is the CDC's interim guidance for businesses and employers. This is actually a really useful webpage, document, whatever you want to think of it as. If you just Google that, it'll be the top hit. And the CDC is updating that somewhat regularly, and they're alerting you to what they've updated, which is really handy. So if you haven't looked at that, it is a pretty nice reference. It's got some specific information as well as some sort of big picture stuff to be thinking about. I also want to point out that third bullet. Obviously, we know we're supposed to be disinfecting things frequently if we're still open to the public, if we still have, employees coming in, but it can be hard to find products that work for that. As if you've been to, a grocer lately, the cleaning aisle product is in worse shape than the toilet paper aisle these days. But if you search COVID List N, you will find a pretty long list of resources, sorry, not resources, but products that will kill this particular coronavirus. So that could be useful to you. And then the other one I want to point out is ventilation with outside air. So I just saw a study that came out a couple of days ago, or it wasn't a study, it was a result of some contact tracing done in China. And they discovered that like 10 people had been infected just from sitting in the same space as someone who was sick with the AC running because it was just recycling air. So whatever you can do, if you've got people coming in, to get outside air into the building is going to be useful. So open doors, open windows. Don't just crank the AC unless you know for a fact that the intake is pulling outside air and it's not just recycling air. One of the questions we started getting fairly early on, and we're still getting, is can we take temperatures or ask employees about symptoms when they come in for the day? And this is an interesting one because in most universes, the answer would be absolutely not. We can't do a medical exam or get into what's potentially, a medical inquiry or disability inquiry with employees. But COVID-19 is special. It's a worldwide pandemic. And it's considered a direct threat in the workplace. So we can take employee temperatures. Ideally, you're going to get one of these forehead, thermometers where you don't have to have anybody put anything in their mouth or pass anything around. There's just one person holding on to this thing. This might be hard to come by right now, in which case probably disposable is your next best bet. I'm not a doctor, so I don't want to give a whole lot of advice on that. But you should be careful if you decide to go the road of taking temperatures, that you're not creating more risk by passing something around or contaminating something. Also keep in mind that temperatures, even though it seems like really basic tiny bit of info, is private health information that you need to keep confidential. So no, announcing people's temperatures as they come through the temperature check line. If you're going to ask about symptoms, make sure you keep it specific to COVID-19. Don't be asking open-ended questions like, how do you feel today? Does anything hurt? We want to get that list of symptoms and stick to it. And then remember that just because somebody doesn't have a fever or doesn't have symptoms doesn't mean they're not carrying the virus. So you really need to not back off on any of your other safety measures. What about sick employees? What do we do with somebody who seems to have symptoms? Well, you separate them from everyone else immediately and then send them home and tell them to stay there. How long they stay there is going to be between them and their healthcare provider, but I wanted to give you a sense of how long they'll probably be asked to stay home. So generally it's going to be like 72 hours after they're done with symptoms, including a fever, without taking anything for it. So if you've got kids who are school age, you might be used to the 24-hour rule after a fever. We're extending it for COVID-19. We're saying 72 hours or 7 days since symptoms first appeared, whichever is longer. So if somebody has a symptom for a couple of days, they should wait more than 72 hours. They should be gone, a whole 7 days from when their symptoms first appear. Again, their healthcare provider should really be providing this guidance, but I did want to give you a sense of how long somebody might be out if they leave sick. It's not going to be 14 days. 14 days is about incubation, so this is a different measure. If an employee is diagnosed, do we need to tell everyone else? Well, you need to tell everyone else that they may have been exposed, if they may have been exposed, but we don't want to tell them exactly who's sick. So if your whole workforce has been home for 5 weeks, like I have been, and someone gets COVID-19, you don't need to tell everybody. That might seem obvious, but that's information we don't need to share. However, if you still have employees coming into the office and one of them calls you up tomorrow and said, hey, I was just diagnosed with COVID-19 and I was in the office yesterday, then yeah, you need to let people know they were exposed. You don't need to shut down the office or quarantine it. Generally, what's going to be recommended is that you do a super duper disinfecting job and also stay away from that employee's area and then have other employees sort of watch their symptoms. This is actually covered in that interim guidance for employers guide that I mentioned. So again, I would encourage you to check that out. It's got some pretty useful guidance. In a small organization, I realize that employees will probably figure out who has COVID-19 if you send a letter saying, hey, somebody had, COVID-19, you've been exposed, yada, yada. We're not going to name them. Your employees may figure that out, and that's okay. It's not your job to make sure the secret stays a secret for all eternity. It's just your job not to share it directly or indirectly for that matter. but don't feel like, just because they figure it out, you are in trouble, as long as you weren't, the source of the information. What about employees who are out sick and we're not sure why? Can we ask them about their symptoms? Yes, you can, and you should keep it specific to COVID-19. The thing at this point is that employees who are out sick, who probably have COVID, will almost certainly be asking for leave under the FFCRA. So they're probably not going to be keeping their symptoms a secret from you anyway. But if they do, if somebody just calls in sick and hasn't explained themselves, you're more than welcome to ask them about their symptoms. But again, use that list. Don't just be open-ended about it. And then if you discover that they have symptoms that seem to align with COVID-19, or they've been told by their healthcare professional that they probably have it, then you'd probably want to go ahead with that letter to other employees about potential exposure. Somebody chatted in, can you request a copy of their test results? No, you cannot. So we'll get to the kind of documentation you can ask for if somebody is taking leave under the FFCRA. If they're not asking for FFCRA leave, I guess you could try to ask for a doctor's note, but the CDC is encouraging you not to do that because the healthcare system is overwhelmed, and almost certainly they are going to ask for that emergency paid sick leave because there's no reason for them to be unpaid when they could instead be paid for that time. But no, you cannot ask for a copy of the test results. Most people aren't being tested. I have several friends actually who've been diagnosed with COVID-19, but it wasn't through testing because testing is still just not widely available. You should not assume that employees have access to that. What most of them are doing are calling their doctor on the phone, describing their symptoms. The doctor says, yep, sounds like COVID-19, stay home, don't go out, isolate. And after X number of days, after symptoms are gone, then you can, return into the world again. One of you asked about the name of the guide. So it's called the Interim Guidance for Businesses and Employers, I believe. You will get a copy of this deck, and I named it specifically on like my very first slide that had substantive information. So you'll get a copy of this and you can go back to that, but it's called like Interim Guidance for Employers, and it's from the CDC. So that's a good reference document if you do find out someone is sick. What about somebody who has a sick family member? Can we ask them to stay home? Should we ask them to stay home? Yes. So anybody who's sick, anybody who lives with somebody who's sick with COVID-19 or something that's likely COVID-19 needs to stay home. They need to do the 14-day incubation period, dance. And you as an employer are welcome and encouraged and should in fact enforce that. So that is not a problem at all. If somebody's got a family member who's sick with, cancer and they're going through chemotherapy and the family member is high risk, you should allow that person to stay home if they want to, just sort of out of the goodness of your heart, so they don't end up, infecting and killing their family member because they've been out in the world. But that's going to be the employee's decision ultimately. So you shouldn't be telling an employee that they need to go home and stay home with no work and no income just because they live with someone who's high risk. It's really their job to figure out what their level of risk tolerance is. It's not your job to put that on them. We've had a couple questions coming in about the FFCRA, and like I said, we will get to that pretty soon and probably cover most of your questions. What about employees who are just afraid to come in? Can we make them? So particularly now with some states opening back up, which is, maybe in line, maybe really not in line with general guidance. Some employees are saying, I don't think we should be opening back up yet. I don't want to come in, I'm afraid. What do we do about that? Well, this is a tough one. If there is no legitimate threat, which is a little bit hard to prove, and the employee doesn't require an accommodation because they personally are high risk, then you can enforce your attendance policies. So if you're opening to the public and you're not going to enforce social distancing and you're not going to require anyone to wear masks, and there are still many new cases every day in your state, I think an employee could make an argument that there is a legitimate threat. If you are going through all of the safety procedures that are suggested, you are enforcing social distancing, you're having people wear masks, you're creating separation in the workplace if you're in office, whatever it may be, then I think it's going to be harder for an employee to say, I feel a legitimate threat here. But this is a little bit of a tough one. And if an employee is high risk, you should grant a reasonable accommodation, allowing them to either take a leave or work from home. I want to talk really quickly about work from home policies. So if you're sending people home for the first time, or they've been home for a while now, and maybe it still feels a little loosey-goosey, it's probably a good idea to have a policy. In that policy, you'll want to cover hours you expect employees to work, probably the same hours you usually expect. You'll want to cover expectations regarding reachability. So do you want them to be on Slack all day, or Skype, or Google Hangouts? How do you need them to be available? Or do you just want them to be, reachable by phone? That's fine too. If there are a certain frequency of check-ins that you'd like to see, explain that. So how often should they check in with their subordinates? How often should they check in with you, their manager, etc.? And then also cover office expenses. So if you don't intend to cover the cost of anything for them to work from home, you should say that. If you intend to cover reasonable expenses, but you want to pre-approve them, say that. If you want to send them home and give them a $500 stipend to make their home office amazing, because you might not ever bring them back, say that as well. Just be clear about your expectations. Otherwise, you could end up in some kind of gnarly fights with employees about, expenses that you don't think were reasonable, that they thought made perfect sense. And then we've just got a couple work from home tips here as well. I guess it's not a couple, it's 6. First of all, if you are working from home, make a space that is your workspace. I do have at least one colleague who says she can't stand being in one place for more than, an hour. So she moves around her house. I think more often than not, though, people do better when they've got an area that's designated for work. It just sort of helps them get in the right headspace. Also try to maintain hours. So this will help with the separation between work life and home life, which can get blurred very, very easily when we are working from home, particularly if we also don't have a space that's like a designated office space. Getting dressed, always good advice. Once again, this is all about getting in the headspace. It's possible that your colleagues don't care what you look like on Zoom or GoToWebinar or whatever you're using to meet, but it will help you get in the right frame of mind. Don't forget to drink your water and take breaks. I drink so much more water at the office, it's not even funny. And I'm up and down for those water breaks. And yesterday I got up from my desk and my hips just hurt like crazy because I clearly hadn't moved probably more than once all day long. So do what you can to keep your body mobile and hydrated. And then finally, make sure you're communicating and make sure you're doing it for fun as well as for business. So when we're in the office, we have a lot of sort of random interaction with our colleagues, and that actually means a lot at the end of the day. You might not really notice it until you've been home alone for a while, but it really does add up. So make the effort to reach out intentionally to your colleagues and check on them. And likewise, if you have direct reports, I think it's a good idea to check in with them once a day. Even if you don't need an update on their work, maybe they're just totally self-motivated. That's not what it's about. It's just acknowledging that they exist and you haven't forgotten that they're out there. All right, so in just a minute, we're going to launch into the FFCRA. If you have questions on that, we'll almost certainly cover them. But before that, we want to take just a couple of polls, which Josh is going to come back in for.
Thank you, Kara. Yeah, we're going to do a couple polls here. I'm going to share the results. I'm going to launch the first one right now. The question is, what actions have you already taken in response to COVID-19? Options are reduced hours, laid off employees, furloughed employees, applied for SBA loan or other financial assistance, closed or closing your business entirely for the time being. Recalled employees, something we're starting to see signs of more, which is certainly hopeful and optimistic. And then sent employees to work from home. And then, of course, no actions yet, just really looking at the options. So we're at 45%. I'm going to give this another 3 seconds here. While you're doing this, I'll remind you we are going to be sending the slides and the recording to you by email. Give us about 24 hours to do that. And then it looks like most everybody is doing a great job of sending questions into the Q&A. Some people still using the chat, though. If you want to maximize the visibility of your question, make sure you're using that Q&A box. Okay, we're at 70%. I'm going to end this poll and share the results just so you can get an idea of where everybody is, where your peers are. So looks like number one, and this has been consistent across all of our polls, sent employees home to work. Second is applied for the SBA loan. Looks like a good number have done that. And then all the others, kind of a spattering of results across these others. So interesting information there. Okay, we're gonna do one more poll here before we kick it back to Kara for the legislative updates. Question number 2. This is, what COVID-related topics are you most interested in learning more about? So, considering all the challenges that we are now facing as employers, which of these do you find yourself wishing you had more guidance on? Managing work from home employees, supporting corporate culture with a dispersed workforce, compliance considerations around layoffs, furloughs, and recalls, handbook and policy management, workplace health and safety after COVID-19. What are the new norms going forward, having been what we've all been through recently, and then continued guidance surrounding the legislative part of COVID-19. So we're at 57%. I'm going to give this 3 more seconds. Thank you so much for your participation. 3, 2, 1. I'll close this out. And just for your information, it looks like the 2 winners are the bottom 2, continued guidance on the legislation, and then workplace health and safety after COVID-19. And then it looks pretty evenly dispersed across the others. 3rd place is compliance considerations around layoffs, furloughs, and recalls. So we appreciate that feedback. This largely informs where we go with these events, which are all geared to be a value add, to provide insight. And we certainly want to hit the nail on the head with what people are wanting. So I'm going to stop sharing that. And Kara, back to you for the FFCRA.
All right. Okay, so this law has been in effect since April 1st, and we're all getting a little bit familiar with it. But I think this will be an ongoing point of concern for employers, at least until the end of the year when it ends. For many employers, although I'd suspect not a lot of our current audience, this may be their first exposure to required sick leave, or really sort of any federal legislation that impacts them if they're a small employer, or if they're operating in states that really don't do a lot with employment laws. So this is a little jarring for some employers out there. We're going to talk first about the emergency paid sick leave provisions, so who they apply to and how they work. Then we'll talk about emergency FMLA. Then we are going to get into exceptions and exemptions from the law or for certain individuals. And then we'll talk really quick about the payroll tax credit, and I'll give you a link to some other resources that you can access. So first up, emergency paid sick leave. Who does this apply to? Well, it applies to all private employers with fewer than 500 employees. So that's a massive swath of the of the country and the employers who are out there. It's available to all employees no matter how long they've been employed with you. So if you hired them tomorrow, they would be eligible for EPSL the next day. Healthcare providers and emergency responders can be, but don't have to be excluded. We'll talk more about that a few slides down the road. And then how does this interact with other paid time off benefits? Well, EPSL is in addition to any other PTO or sick leave you offer. Employees can't be required to use other benefits first, and you, an employer, can't reduce the benefits you offer because this act is available or because these leaves are available. So if you previously offered 3 weeks of PTO per year that could be used for any purpose, including sickness, you can't reduce that to 1 week now because EPSL offers 2 weeks. So you have to continue to offer what you offered before, and this is just on top of that. It can only be used for certain things, though, and they are all directly related to COVID-19. So when can this be used? Well, first of all, only when an employee is unable to work or telework for one of these reasons. So, for instance, if they've been told to quarantine by their doctor because it sounds like they might have COVID-19, but they feel fine and they're perfectly capable of teleworking, then they're not going to get EPSL. Teleworking is the DOL's term for working from home, of course, and we've all sort of been laughing because it seems incredibly dated, but it does sort of work as like a noun and a verb and all these other things a little bit better than saying working from home all the time. So first up, an employee can use this if they're subject to a federal, state, or local quarantine or isolation order, but that doesn't apply if they've been furloughed, laid off, or the business is closed. So if your state has a stay-at-home order that applies to an employee in particular, but the place they work is still open and has work for them to do, they could get EPSL. In most cases, though, these stay-at-home orders have caused businesses to either furlough people or lay them off. In that case, your employees don't get EPSL. This in particular could apply to like somebody stepping off a cruise ship and the CDC is standing there and says you're going to go live in that hotel for 14 days. That's really the kind of federal, state, or local order that we're mostly talking about here. For number 2, it can be used if an employee is advised by a healthcare provider to self-quarantine because the provider believes the employee has COVID-19 or is particularly vulnerable to COVID-19. So again, most people aren't getting tested for this. Their providers are just guessing. So it's possible they got a test, and so we know for sure that they have it. But in most cases, it's going to be like, yep, that kind of sounds like it. You should stay home. So that's going to be number 2. Number 2 also applies if an employee is high risk. So it only applies for 2 weeks though, right? So if somebody is like, let's say pregnancy is considered high risk, diabetes makes you high risk. So if someone was diabetic, they could have their healthcare provider say, you should stay home because you're high risk, you're particularly vulnerable, and they'd get paid for 2 weeks. After that 2 weeks, you'd be talking to them about a reasonable accommodation for them to continue to stay home or, work something else out. We'd be looking probably at the ADA, but they wouldn't get paid. They wouldn't get EPSL for eternity just because they're high risk. This will only apply for 2 weeks. It can also be used if someone is seeking a medical diagnosis for symptoms of COVID-19. So this could take an hour in the morning when they're calling their healthcare provider, or it could take all day if they're on hold or they actually have to physically go to a clinic or something like that. We can also use EPSL if we need to care for someone who qualifies under number 1 or number 2. So let's say grandma has been advised to self-quarantine because she's high risk. She's not only 82, but she's also diabetic. If grandma is a very spry 82 and the diabetes hasn't, impaired her quality of life or her, ability to care for herself, then an employee does not need EPSL to go care for grandma. If grandma is not spry, if grandma is in really bad shape, and her usual caregiver is unavailable because of COVID-19, for instance, and so your employee needs to go take care of her, then number 4 will apply because she requires care, and that's causing your employee to be unable to work as a result. We can also use EPSL for a child whose school or childcare provider is closed or unavailable. So this does include individuals who care for your children, whether it's paid or unpaid. And then number 6 is a moot point. I should really just put strike through on number 6 because it does exist. It's out there in the regulations, but this substantially similar condition has to be defined by the Secretary of HHS before it's in use, and we don't have that definition yet. So really there is no number 6, and I think there probably won't ever be a number 6. It's a little bit of a placeholder, like maybe something else will crop up as a result of this and we'll fill in number 6. But for now, don't worry about number 6 at all. Somebody asked about a business closure for a pre-scheduled company closing. So no, that's, first of all, if your business is closed, they don't get EPSL, period, end of story, because there is no work for them to do. You have to be open with the employee, with work available for the employee in order for them to claim EPSL as a result of, a federal, state, or local quarantine order. So no, if you were already scheduled to be closed or you were closed spontaneously, EPSL is not going to apply because you don't have work available for the employee that day. Let's talk about duration and pay. So for full-time employees, they're going to get 80 hours. If they usually work 60 hours a week, they don't get 60 hours per week. They get 80 hours total. Part-time employees, though, will get the number of hours they usually work over a 2-week period. So if they usually work 20 hours a week, they're going to get, 40 total. This can be taken intermittently for childcare purposes if the employer agrees. I would strongly encourage you to allow intermittent use for childcare purposes, because if you don't, in many cases, the employee's only other option will be to quit because the government does not endorse free-range children. A 3-year-old cannot stay home alone and feed themselves. So if you're making an employee choose between caring for their children who actually need care versus keeping their job, they're probably going to choose their children. And under current circumstances, there's a really good chance they're going to get unemployment insurance benefits for that if they had to quit as a result of a COVID-19 related reason. So if you want to keep an employee around, being flexible and working with them to do intermittent leave is really going to be your best bet. It can be taken intermittently for illness-related reasons, but only if the person's teleworking, and again, if the employer agrees to it. So for instance, had a coworker who had COVID-19, had it for probably several weeks, but she didn't feel terrible for much of it. So, she was teleworking and, used it intermittently, like one day felt really bad, next day she felt fine and worked, and then she felt bad again. So that's really intermittent use of this leave, and she was teleworking. It can also be used in separate chunks. So if somebody wants to use a week right now to take care of grandma, and then somebody else takes over and cares for grandma, and then 3 months from now, the employee comes down with COVID-19 or needs to care for their child, they can use the other week of their EPSL then. For uses 1, 2, and 3, where you're caring for yourself, employees can get up to $511 per day or 100% of their regular pay, whichever is less. If they're caring for someone else, reasons 4 and 5, there's a cap of $200 per day or 2/3 of their regular pay, again, whichever is smaller. Somebody, let me grab a couple of these questions here. Somebody said, should we expect employees who are afraid to come to work to communicate with us daily? you can expect that, but I would communicate it with them. Don't fire someone just because they didn't communicate with you every day if you didn't ask them to communicate with you every day. So yeah, if you've got an employee who's out, for the foreseeable future and you want to hear from them every single day, you can ask for that. That's perfectly fine. However, given that this is ongoing, let's say they're high risk, they're going to remain high risk, COVID's going to remain out there in the world for quite a while, you might just want to have them check in weekly. Whatever your expectations are, though, just make sure you communicate those. And then somebody asked, how do we handle an employee who has a fever but will not go to the doctor or get tested? We've made him stay at home, but can we make him get tested? Should we have him quarantined for 14 days or refer to the 72 hours after the fever diminishes guidance? Wow. I don't know why he can't go to the doctor. Perhaps he doesn't have health insurance, but you can't make him, well, I mean, you could try to make him get tested, but again, I'm going to come back to this thing where not everybody gets a test right now. I mean, there are states that I think are still only testing a few hundred people per day out of millions, who live in the state. So I don't think you can force anyone to get a test just because I don't think people can go demand a test. That belief seems to be out there, but I don't think it's true. So you can certainly require him to talk to his doctor. Again, you can't literally force him to do it, but you could say, call your doctor or you don't have a job anymore. I wouldn't encourage taking that leap just yet. But as an employer, you have quite a bit of leverage here. I don't want to give you advice on whether he needs to quarantine for 14 days. He doesn't need to quarantine at this point because he does have symptoms already. Well, I'm sorry. He needs to isolate because he has symptoms. He's not quarantining for 14 days, though, just to see, if the incubation period turns into an illness. So probably should follow the 72 hours guidance that you're referring to that was on one of my earlier slides. But really, truly, he needs to talk to a doctor. So I would maybe take some draconian measures to get him to at least call a doctor and talk to them because he is a direct threat to your workplace right now. And it sounds like he's being pretty unreasonable, unless, of course, he really can't afford to talk to a doctor, in which case you might want to help him with that. If he's unable to afford that, you might want to assist so that he can make that phone call and do what he needs to do. Let's talk about the FMLA. So this is the much larger leave. This is up to 12 weeks for when an employee needs to care for a child. It applies to all employers with fewer than 500 employees. And it applies to all employees who have worked at least 30 days for the employer. So somebody chatted in, and it was a good question. They said, if someone's out on maternity leave right now and it ends in a week, can they go on FFCRA since the law states they have to have been working for the last 30 days? So that's a slight misreading of the law. They have to have been employed with you for at least 30 days. So presumably this person who's out on maternity leave has been employed with you for many months. So yes, she would qualify for FMLA. That is assuming that she would have come back to work and put the baby in childcare or daycare, and the daycare is no longer available because of COVID-19. In that case, she would qualify for this leave. Once again, use for this is if the employee is unable to work or telework because they'll be the only caregiver for a child under 15, unless special circumstances apply. So under 15 is coming from the IRS regs. You're not going to get that from the DOL, but when you combine what the IRS wants with what the DOL wants, we come up with this 15. So if an employee has a 14-year-old who's perfectly capable of playing video games all summer long and does not need their attention, then they are not unable to work or telework. However, they only need to certify that this is true, meaning check a box, write a sentence. You can't ask for proof that, their 14-year-old can't just play video games all summer long. It's a little bit sticky, and I know employers are pretty uncomfortable with this one because it's a pretty big offering. You will get your money back, but I understand that having employees, out of the office is problematic. But we're very limited in what we can do to sort of like make employees prove that they need these leaves. All right, so let's look at duration here. EFMLA is for up to 12 weeks, like regular FMLA. If you're an employer who has regular FMLA, you're over 50, so you provide traditional FMLA, this is not an extra 12 weeks. So if someone has already used up 6 weeks of traditional FMLA, they will only have up to 12 weeks of EFMLA for childcare. The first 10 days are unpaid, but employees can use any other leave they have available during those first 10 days if they want to. And that includes EPSL. So if they haven't used that emergency paid sick leave up for sickness, then they can use that during these first 10 days of unpaid EFMLA. After 10 days, there's going to be a cap of $200 per day or up to 2/3 of regular pay, just like with uses 4 and 5 during EPSL. Once those first 10 unpaid days are over, even if they weren't really unpaid, employers can start to require an employee to use their available paid time off, like vacation or personal time, but not sick leave, during that absence. So if you've got an employee who has, let's say, 4 weeks of leave piled up, and they take their first 10 days of EFMLA and they use EPSL to cover it. So they got their $200 a day for the first 10 days. After that, you can make them start using up their PTO bank. While they're using up their PTO bank, you can still claim a $200 tax credit against that. Once their PTO runs out, then you're back to just paying them sort of $200 out of pocket, but you'll still get the credit, so you get the money back right off the top of your payroll taxes. So this little bit of guidance has changed a couple of times in the last few weeks. So I would encourage you, if you are starting to administer EFMLA for the first time, or even if you just haven't read the regs in a while, to go check the DOL's questions and answers page. They are updating it daily, but guidance on this one has been a little bit squirrely and has changed a few times. So I definitely would encourage you to look for the most recent resources before administering leave. All right, so what kind of documentation do we need for this? The DOL has said that you can ask for a certain amount of information and not more than that. So that's what we're going to talk about right now. This is also the information you need in order to claim the IRS credit. So they basically line up. I've combined them for you. This is what you need to know on this page. You need the employee's name. You need the date of the leave they want. You need the reason they're requesting leave. So is it 1, 2, 3, 4, 5, or 6? Except not 6. And you need a statement that they are unable to work, including by telework, because of that reason. Then you need a little extra, depending on what the reason is. So if it's related to a quarantine order or self-quarantine advice, then you need the name of the government agency or entity that told them to quarantine, or the name of the healthcare provider that told them to. If they're caring for someone else who's subject to that government order or that quarantine advice from a healthcare provider, we need the name, again, of the government agency or the healthcare provider. We need the name of the person they're caring for, and we need the relationship of that person to the employee. So grandma, sister, roommate, whatever it is. If an employee is taking time off for school closure or childcare unavailability, then we're going to include the name and ages of the children, the name of the school or place of care that's closed, and a representation that no other person will be providing care for the child during that period. If the child is 15 or older, and this includes grown adult children, and there are special circumstances that require the employee's care, they're just going to basically tell you there are special circumstances that require care for a child 15 or older. They don't have to explain it to you. They don't have to prove it to you. They just have to affirm, check a box, sign their name, whatever, to tell you that there are in fact special circumstances. You can't ask for more information than this in order to provide FFCRA leave. Somebody asked, if an employee uses emergency paid sick leave to care for a child whose school is closed, do we automatically designate this time as EFMLA? You can run those two concurrently. We were actually just getting into this yesterday. This is a little bit confusing. Actually, if the employee asks to use them concurrently because they want to get paid during those first 10 days of EFMLA, then yes, they can run concurrently. So if they're using EPSL, then they're getting paid and you should go ahead and designate it as EFMLA. However, if an employee just comes to you and says, I need to care for my child, give me leave, you should ask them, do you want to start with EPSL and get paid for the first 10 days? Or do you want to start with EFMLA and have those first 10 days unpaid? Because the employee should have the option of saving their EPSL for later. Most employees will probably just want to get paid now, so they'll choose to use EPSL during those first 10 days of EFMLA, in which case they will run concurrently. However, they should be provided the option of taking EFMLA first and not using EPSL during those first 10 days. That's a really good question. All right, for number one, I wanted to come back, that number one use for sick leave. I wanted to circle back on this whole, this doesn't apply to furloughs, slowdowns, or closures caused by stay-at-home orders, because this is a point of major confusion. So if you, the employer, have closed your work site, or if you've sent employees home because there's a lack of work, it could be that you sent some employees home, it could be that you cut everybody's hours in half, it could be that you closed the entire office for the next 3 weeks. If that's the case, employees are not entitled to EPSL. It doesn't matter why the office is closed. It's not that the employee is out of work because of shelter-in-place order caused the office to close. There has to be work available. If there's not work available, the story is over. The only time EPSL will apply is if there's an order that applies specifically to an employee while their employer is still open and doing business and has work for them. So let's say we've got a grocery store greeter who's over 70. The grocery store is an essential business. They're still open. They'd still love to have the greeter there. But, you know, the greeter lives in a state where they said, you know, people over 65 need to stay home. Period, end of story. Do not leave your houses. That would be a situation where this would apply. There are some exemptions for small employers, but they need to be used carefully and sort of individually. So you can, if you have fewer than 50 employees, you could use an exemption from child care leave only, not for any of the sickness reasons under EPSL, just for the child care part. If providing leave would basically put you out of business. So it can't be a blanket claim that you're not going to provide leave. You can only deny it if it would cause you to cease operating at a minimal capacity. In a lot of cases, you're just going to have 1 or 2 people, if you're a small employer, who ask for EFMLA, and they're totally willing to use it on an intermittent basis so they can trade off childcare with their spouse. Providing that person with leave almost certainly will not put you under, especially since you get to take it right off the top of your payroll taxes. So you're probably saving money for those payroll taxes. You just get to tap into that bank account where you've got that money saved and pay out of that because you're going to take it right off the top of your taxes. You could also deny someone leave if they're so essential that you can't live without them. That's bullet number 2 there. I would encourage you to be careful with that one though, because employees who don't have an option for, I'm coming back to this 3-year-old at home. Let's say you've got a single mom. If you tell her, no, you're so essential, I can't live without you, you're the only person who does my, my payroll, she's still going to have to choose taking care of the kid. So once again, she'll quit, she'll get UI, and then you won't have a payroll person at all. So I would definitely encourage you to negotiate with people before you try to use an exemption. And then finally, you could use one if you just don't have sufficient workers to get the job done. If you're an Etsy shop and you've got 2 people who make your product, one of them makes the first half, the second makes the second half. Without either one of them, you would have no product to sell. You could deny that person childcare leave. All right, the next 2 slides are about exempt healthcare workers and exempt emergency responders. I put all the words that the DOL uses, so you can come back to this later since you'll have a copy of the deck. I will not read them to you, I promise. What I want you to take away from this is that you're not required to exempt healthcare workers. And the DOL would actually like to encourage you to be judicious when using these exemptions. If you think someone might have COVID-19 and you're in a healthcare setting, the DOL would really like you to give them leave and send them home. It's not that the IRS or whatever doesn't want to pay for their leave, it's that we know hospitals need to remain well-staffed. That's why the exemption exists. But if you can afford to let that person go, and by afford I mean in terms of staffing, then by all means you can let them take these leaves. To pay for these leaves, you're going to take the amount you spent on them right off the top of your payroll tax bill. So if you spent $5,000 on leaves and you've got an $8,000 payroll tax bill, you're just going to pay $3,000 instead. If you're having to give more leave than you would have saved for payroll taxes, you just don't have the money, then you can apply for an advance. That's IRS Form 7200. So here are a couple resources on this page. DOL questions and answers, I would encourage you to check with that regularly. They do update it. And then you can go to this IRS FFCRA FAQs. Is really good that the IRS has put out about figuring out the payroll tax. All right, let's talk about reducing hours or closing pretty quickly here. For non-exempt employees, we know we can reduce their hours. That's pretty straightforward. If you send them home at the start of a shift or midway through a shift and you're in about a dozen states, including New York and California, you may owe something called reporting time pay. So check state law for that if you're sending somebody home mid-shift. You can also reduce employees' hourly rate, but we need to make sure we give them notice before we do that. And we also want to make sure we're not doing that retroactively if we're midway through a payroll period. For exempt employees, reducing their hours doesn't really do anything. We can reduce their pay, but we need to stay above the federal minimum salary or the state minimum salary for exempt employees. So it's like their own version of minimum wage for salaried individuals who, generally are manager types. So California and New York both have minimums in the $1,000 range, depending either on your size or your location. And the federal minimum is $684 per week. So you can't prorate this number. Let's say you've got an exempt employee who's making $1,000 a week in the state of Ohio. They work 40 hours a week. You'd like to cut their hours in half and cut their pay in half. So 20 hours a week, $500 a week. We can't do that because it's below that federal minimum. What we can do instead is reclassify them as a non-exempt employee. You don't want to be flipping someone back and forth between exempt and non-exempt regularly, but under the circumstances, I think a lot of employers are doing it sort of for the foreseeable future, and that's okay. Once again, make sure they're getting notice that you're changing their pay and that it's not retroactive. Also remember that those people will now be entitled to breaks and overtime. If you are furloughing employees, they will be eligible for unemployment insurance. So you don't need to fire them. You don't need to fully terminate them or fully lay them off. You can just furlough and they'll have 0 hours and they'll be able to go claim UI. Don't worry about your SUI rate, so your state unemployment insurance tax rate that you sort of pay in for the unemployment insurance funds. Usually that's based on turnover, but it looks like most states are going to be forgiving furloughs and layoffs related to COVID-19, so don't stress on that one. When you're furloughing employees, make sure you're addressing their benefits. So chances are they will lose healthcare eligibility and will need to be provided information about COBRA or mini COBRA. So make sure you're staying on top of that. Talk to your broker if necessary and to get into the fine print of your plan and determine what you need to do for employees. If you can't make payroll, this is the one time in the presentation I'll suggest that you call an attorney. There are just too many factors at play, and the liability, will be different depending on how many people you employ, how much you pay them, what states you operate in, et cetera. So if it looks imminent that you're not going to be able to make payroll, do call a lawyer. I've just got this one last slide, and then I want to hit a couple more of your questions before we close. So there is help out there. If you Google FBA relief options, you can learn about some of the options that are available, particularly to small and medium-sized employers. I took the PPP bullet out of here because it was out of money, but it looks like they refunded that like over the weekend or a couple days ago. So I should put that bullet back in, but there is the payroll protection program. That's sort of outside of our scope. We can't really talk to you about that. You should talk to your tax person. But there is some hope out there. All right, I would like to pick off a couple of Q&As. I don't know if Josh wants to leap in now while I look at those.
Yeah, absolutely. I tell you what, while you're reviewing some of those, we can come right back to you to answer some more of the questions. Just a few things to wrap this up before Kara answers a few more questions. Thank you all for attending today. We will be sending these slides and the recording to you in about 24 hours. To learn more about Viventium and our services, you can check out the website at viventium.com. As always, we really value your feedback from these sessions, and we do look forward to sharing with you more insights that will help you navigate this critical current event. We're also excited about the recent release of our COVID-19 product suite. So this full suite of resources provides crucial support during the ongoing pandemic and is available to all clients immediately at no additional cost through the end of the year, through the end of 2020. To learn more about that product suite, please visit the COVID-19 products page at COVID-19-products, and you can check that out. So, Kara, I'll come back to you to tackle a few of these questions.
All right, cool. All right. Someone asked, can you require a doctor's note after so many days to make sure someone is able to return to the office? No, you don't want to be requiring a doctor's note to return. Theoretically, maybe you could ask for this, but it would have to be unrelated to their leave. Like you couldn't threaten to not give them FFCRA leave as a result. And the CDC is really begging that you not do this because doctors just don't have the time to talk to a patient and write a note that says you're fine. They need to be dealing with the people who are still sick. So I would say no, do not be asking for notes to return to the office. Somebody asked, what if an employee qualifies for emergency paid sick leave, but we'd like to term that employee? Do we need to wait? Yeah, I would at this point. I would let that person take their EPSL and probably terminate them at some point after that, since again, the government's going to be paying for that. It's not really coming out of your pocket. If somebody asks for EPSL and you say, how about you be fired instead? I think that could very easily result in a lawsuit. So, really, we should be firing poor performers as they happen, right? We need to be writing them up and doing the documentation and terminating them when they deserve to be terminated. Waiting until they ask for something like FMLA or EPSL or an ADA accommodation and then terminating them looks extremely suspicious and is very likely to get us in the middle of a lawsuit. All right, and then I'll just take one last question, which was, as we return to work, aside from being 6 feet apart, masks, temperature checks, teleworking, what are things we should look into? Well, that is sort of the million-dollar question right now. Employers want to know what to do next. And we don't have regulations or guidance on this yet. So we're all just sort of like doing our best to figure this out. I think what you mentioned, which is, following social distancing, having masks, having temperature checks, and letting people work from home, those are probably the 4 biggest things you can do. Regular disinfection and deep cleaning is probably another thing to do. Looking for ways to eliminate touch points in the office or the workplace. So if you're a retail business and you can figure out how to do tap and pay, so people can just, shake their phone at your cash register and then not have to touch the buttons. I know for me, I use tap and pay. I think it's really cool. Sometimes when I use it, it makes me enter a PIN, and sometimes it doesn't. Assuming that's something that the retailer can adjust, it would be really cool if retailers everywhere removed the PIN functionality so people could truly pay without touching anything. So we're certainly looking into this. It's a topic we're all really interested in as well, and as more things become apparent, we'll definitely be sharing that with our clients. Thanks all for joining us today.
Great. Thank you, Kara. Again, one last time, we'll be sending the slides and the recording to you. Watch out in your email. Again, feel free to jot down these URLs on the page right now if you want more information about Viventium or the COVID-19 suite. Thank you for joining us today, and we hope you have a fantastic rest of your afternoon.